Why is exercise good for your heart, especially with heart failure? Cardiac rehabilitation is a structured exercise program and consists of education that's proven to help people with heart failure feel better, live longer, and stay out of hospital. What can it do for you? Well, it can help you breathe easier and help you walk further without getting as tired. It can improve your energy and reduce your fatigue. It can boost your confidence to remain active. It can lower your chance of going back to hospital. It can possibly help you live longer, especially if you stick with it long term. And it can improve your quality of life, mood, and sleep. In this video, you will learn what kind of improvement you can expect from exercise. Does it have to be intense or hard? What does the research say? And what if I can't do much? What kind of improvements could most people expect who join a cardiac rehab program? Well, it can increase fitness by 10 to 30%, can help you walk further in 6 minutes, can help you feel less short of breath. It can reduce heart failure hospitalization by up to 30 or 40%. Often people say, I wish I'd started sooner. Do you have to run a marathon? No, not at all. Cardiac rehab is meant to be safe, supervised, and tailored to you. It is focused on walking, maybe cycling on a stationary bike, and light exercises. Usually it's 2 to 3 times a week. Obviously you can supplement that at home. It can even be done from home or online. Even gentle movement helps. It's all about doing what you can regularly, not pushing too hard. Exercise in heart failure should be now a core therapy, not a bonus. Exercise-based cardiac rehab is an evidence-based, guideline-endorsed therapy for patients with HFrEF and increasingly with HFpEF, or heart failure preserved and heart failure reduced ejection fraction. It should be offered routinely as part of a best practice care. Clinical benefits improve outcomes, improve VO2 peak and aerobic fitness, increasing by 10 to 30%. Heart failure hospitalization reduces. Heart failure hospitalizations reduce by 30 to 40%. All-cause hospitalizations decrease significantly. Health-related quality of life increases consistently based on Q questionnaire scores. All-cause mortality trends downwards, 17% in some meta-analyses. Gains are seen even with moderate intensity aerobic programs. High-intensity interval training may offer superior physiological benefits, but really requires careful patient selection and supervision. Adding resistance training maintains muscle mass and complements aerobic gains, especially in frail or elderly patients. Patients even up to their 80s can benefit from a resistance training program. In terms of practical considerations, home-based and digitally delivered models show similar outcomes to centre-based programs. 6-minute walk testing and VO2 maxes can be monitored. Heart rate and quality of life assessments can be made. Definitely hospital admissions and New York Heart Association classes will tend to improve. Ideally, we would refer early for any cardiac rehab intervention. Exercise is medicine for heart failure. It improves functional capacity, it reduces symptoms, enhances well-being, and cuts hospitalization. Our cardiac nurses and coordinators are pivotal in promoting, explaining, and supporting these interventions. So, why does moving more help a failing heart? What does it do to your heart? Well, it makes it easier to breathe, walk and move. It helps you feel less tired, it keeps you out of hospital, and it can help you live longer. It will boost your mood, your sleep and your confidence. Even a small amount of regular movement can make a big difference to how you feel. What kinds of improvements might you expect? Well, you should expect to be able to walk a bit further, feel a bit stronger, maybe even within a few weeks of starting. Some experience these changes even within days. And the idea is to get you back to doing the things that you enjoy. Many people will avoid hospital trips. Some live years longer when they stay active. And in terms of what kind of exercise, well, mostly walking, cycling, or light body movement can be a good place to start. In general, we would recommend supervision by health professionals, and we would match your exercise to your fitness level and medical conditions. And this can be done either in hospital or in the community centre or at home. And you don't need fancy exercise equipment to start, and you don't need to be fit to start. You just need to start. Exercise snacks are also really helpful. What do I mean by this? Well, you might have noticed that a lot of my videos are done on the move or in my breaks, and I try to put one out when I get a moment, or especially if there's a particular thing that I got inspired by one of my patients. The point is this: we can all benefit from exercise snacks. These are short breaks that we do a few minutes of focused exercise in. It might only be 5 minutes. This could be a very brief walk. It could be 5 minutes of resistance training using bands or body weight or even a wall sit or an easy set of lunges. You might say to me, but doctor, I'm struggling to do anything. I can't even do any exercise. If what you can do is walk to the toilet and back, then maybe that's what you do. If you can do some isometric hand grips in a chair, then do that. If all you can do is raise a 2 kilogram weight, then do that. If all you can do is get out of your chair, then do that. Research shows that these can raise mood, increase mobility and strength, and improve endurance. All these things will improve your quality of life by raising your independence. As always, reach out to your doctor and health team for assistance and guidance about what is right for you. And happy snacking on your exercise.